that. Give me a little maybe small bite block for her for the back. Yeah, for the back. So essentially, if the implant, let's say, would be in the first premolar position, you could do 45 degrees just to gain more cantilever. But if I can bring the implant all the way to the second premolar, first molar, 30 degrees is sufficient. We don't need more than that. So we can open up 4.3 by 15.
There would be with the cantilever after that?
You can put a cantilever on this, absolutely. Not on the immediate prosthesis, but you can definitely put a cantilever. And there's cantilever rules, basically twice the AP spread, really, that we can do cantilevers.
The second question is, what is the minimum length of implant that you use in the posterior area angulated?
Repeat that again, a minimum?
What will be the minimum length of implant that you permit on the posterior angulated implant?
Again, it depends how atrophied the maxilla is, but sometimes if we have really atrophied maxilla and 13 millimeters is all we have, that's all we put. So, but I like to get it, obviously, as long as possible. Those posterior implants are really good anchors. So 15 millimeter is a good length for Anna Maria.
No, I'm asking about the minimum length that you permit.
Again, it depends on the bone. Yes? So if you have only 11.5, we have patients with really atrophied ridge. There's no evidence in the literature that says if you put only 11.5, it's going to fail, if that's what your question is.
Okay.
There's no evidence of that. Probe. So let's measure. These are the long drills, so I want to make sure, always double check. So we're going here to second line. Okay. Perfect. So she has really dense bone, so I'm going to call that moderate bone. We're going to go to number 5. Of course, my choice here is Nobel Active. There's people who like just different types of implants. Just my choice is Nobel Active. Okay. So we're ready to place the implant. 4.3 by 15. Go ahead and open it. Perfect. Thank you very much. Okay. So here we're ready to place the implant. $15mm implant. Always check the speed before we insert it. We don't want to insert this implant at 1200 RPMs. I actually had a patient, a colleague of ours called me the other day. She actually had that happen to her, and the implant was way apical. She couldn't undo it. So, you know, these things do happen more often than we think. Okay. Always when I place the implant, I also look again. I keep the guide in to help me. Because it's easy to lose track here. Okay, I'm at 50 right now. And from this point, I think I like to go by hand. Have a couple millimeters left to go. Torque wrench, please. Again, the science on All-on-4 has been, we have research now for the last 20 years, so this procedure is successful on 4 implants with the angled one. And a lot of that research is done by Dr. Malo in Portugal. I actually went to his center, spent a week with him. Okay, perfect. So we have our first implant in. Always the distal part will be deeper. Okay, so what I have to do is take a rongeur and clean out the bone to ensure that we can seat the multi-unit abutment. Okay, good. So we can finalize the anterior. We can move over to the anterior implant on the right side. I'm going to go back to the precision drill. Looking at the CT scan earlier, this is going to be probably an 11.5 millimeter implant. Yes, 4.3. But let's check here. And of course, she has plenty of bone, so I'm going to place the first a marker to check with the other guy, because the position of the anterior implant is very important to make sure that it doesn't come out through the front. Okay, we're going to take out the All-on-4 guide and we're going to try the other guide with the little marker. I'm actually going to use, here we go. Okay, so when we seat the denture, you see it's seated in the front. I could tell that this marker is coming out about 3 millimeters lingual to the buccal part of the flange, to the occlusal there. Okay, just about where we want it here. Great, so it looks like we're going to get straight abutments. Okay, let's have the All-on-4 guide back on. Okay. So I could feel here, I'm drilling to 11.5, and I'm definitely feeling the base of the nose there. So we're going to stop right there. Her bone is dense, so I don't need to anchor that cortical plate at all. If her bone was porous, I definitely would. Okay, because the bone is dense, again, I'm going to another drill here. Great, 4.3 by 11.5. Looks to be the implant of choice. Small driver. Okay. See, I checked my speed here. Let's go to 50. Her bone is pretty dense. Okay. Open a little bit. Awesome. And again, when we insert the implants, we do not need water. Let's move this up. Again, her bone is pretty dense. Let's do this by hand. It's a self-threading implant. One of the reasons I like Nobel Active, it anchors very well. So I can actually shape the osteotomy as I'm driving the implant down. And of course, I always loosen it, right? The bone has this amazing effect of being elastic, so it's forgiving. So you see here, on my torque wrench. This is the maximum I could take my implant in, so I need to make the osteotomy a little bit wider here, so I'm going to back it out again. And great. Excellent. Nice solid implant. Here we have two of them on the right side. Moving on to the other side. Left. Another way to keep the implant symmetrical, if we have plenty of bone, is by having this guide in. I can actually tell one of the implants is on the last line, so I'm going to do the same with the other side, just for the symmetry effect. But again, it's not really necessary. Depends a lot of times on how much bone we have. Okay. Thank you. You're doing great. Everything going well. I'll go back to this side. Make sure the guide's in place. Okay, a little bit of water. I think my entrance here is a little bit too lingual, so I am going to go back to the precision drill and create myself a better point of entry. Very, very hard bone back here. I believe she did have some grafting at the time of extractions. Okay. Pumping motion, very important when we place implants. I need to move this a little bit. Again, I want to go to 15. Okay. A little more to go here. We're running a little bit into the tuberosity back here. Good. Okay, next drill. Let me check with the implant probe. Good. Solid all the way around. I like to feel the walls to make sure the palatal's fine. No problem. Drill number 5. Okay. We're ready for an implant. 4.3 by 15 again. Yes. Thank you very much. Okay, here we are. I'm always trying to speed before I start. So you could see the threads of the implant. So these threads really anchor into the jawbone. So even if we have softer bone, we can get really good stability. Sometimes I deal with patients that have type 4 bone all the way throughout the maxilla, yet we're still able to anchor Nobel active implants. Okay. Again, the All-on-4 guide in place to make sure we're angling this implant properly. Good. Have to go a little bit more here, so I'm going to self-tap this deeper. Take that out, please, Helder. A little bit of pressure there. We're going to back it up. Again, if I would feel like this is really difficult to advance, I would take it out and drill to make the osteotomy wider. But it's really not necessary. In the mandible, perhaps, but the maxilla is more elastic, and we can certainly expand this bone at this time to seat the implant. You remember, you want to have good stability with this because you're getting immediate function, really. I mean, we always, of course, tell patients soft diet, but I think what we think is soft and what they think is soft are two different things oftentimes. Okay, so here we go. We have one more implant to place here in the anterior. I like to place always a little bit of a marker in the front to see where we're at. So instead of keeping the All-on-4 guide at this point, I'm going to remove it. And we're going to put a 4x4 gauze as a throat pack to make sure we don't drop any small pieces back there. Perfect. Just a little gauze, don't push too far back. Perfect. Just to make sure you're not swallowing any pieces, okay? Let me have the smaller driver, regular platform. It's in the torque wrench. Okay. So I see here's my first guide, and then we're going to try it here for the second. And the reason is I want to keep these implants parallel. So let's see, we're going to go probably an equidistant here, right in this spot. Yep. Okay, starting with the precision drill. Going to number 2 drill. Again, I'm feeling the base of the nose here. Okay, so we're going to go to also 11.5. 4.3 by 11.5. So at this point, what we can do is, I just want to double check one last time here the position of the implant. We're going to take this out. Put this marker here. Actually, I'm going to take this one. Put it here. Let me have the surgical guide, please. Surgical guide. let me push this gauze a little bit out of the way. Okay, good. So you see here, both of my implants are coming out in a good position now on the ridge. 3 millimeters lingual to the buccal flange. Awesome. Greg is happy. It's very important. All right. Thank you very much. All right, I'm going a little more here. Here is the 11.5. You okay? Starting to feel a little pain? Yeah? Okay, I'll get you numb here. Let's have a little numbing. Some lidocaine. So typically the anesthetic that I use is lidocaine and marcaine, just for long term, because, you know, as Greg is fabricating the prosthesis, I want to make sure that she's comfortable. Okay, that's fine. All right. Last drill here. Yay, patient smiling. Section a little bit. Right there. Okay. Let's place the last implant. I have the short, we have the long driver for this one. And the implant. Okay. Here's the last implant, 11.5, 4.3. You have it lifted, perfect. I'm still keeping always the adjacent marker in place on the neighboring implant. With Nobel Active, you can definitely change angulation even at this point. So I try to be as precise as possible, and you see it's already the bone being as dense as it is. Torque wrench, please. Not allowing me to fully seat it with a handpiece. So I'm going to just enlarge this gently. Back the implant a little bit. Mirror, shoulder. A little bit of pressure there. Almost there. Backing it up one more time.